Hello, everyone. You are very welcome to November's webinar series. And I'm just going to give you a few moments for people to get in. And then I need to put my glasses on to see that everyone is in. So I'm just going to wait a few more moments and then we'll start. So you're very, very welcome. This is the 11th Aware webinar in the year, and the time has just flown by. For those of you who are new to Aware, my name is Claire Hayes. I work with Aware as Clinical Director, and I'm delighted to be working today with Shaneika Farrell. And actually it's not work, it's an absolute pleasure. And I'll introduce Shaneika in a few moments. But first of all, to introduce Aware. Aware is Ireland's national organisation to support people with depression and bipolar disorder. It has a range of services, and I'd encourage each of you watching this to make yourself familiar with the Aware website, aware.ie, and it goes through all of the different services that we have. Support and wellbeing groups, support for relatives and friends. There are Zoom programs, and there's Living Life to the Full. And as we mentioned a few months ago, we are now piloting our Living Well with Bipolar Disorder program, and we're really excited by that. So those of you who've attended the previous webinars will know that we've had a tendency towards older people, and I'm not putting myself in that category, but when looking at what was missing, we realized we wanted to get a young person's voice, and I'm absolutely delighted to welcome Shaneika to join us today. Shaneika is also a personal friend of mine, so I have promised her that I will not ask her anything personal, so you will not know her shoe size and anything else about that. So Shaneika, you're very, very welcome, and I'd like to ask you a question I wondered about the very first time I met you, your name. I know loads of people ask you about that, and then to give you an opportunity to say anything that you would like us to know as a context for this conversation today. And thank you for agreeing. I didn't twist your arm too much, I hope.
Thank you very much, Claire, for inviting me today. It's an absolute privilege to be on a webinar for Aware. My name, I'm from County Down up in the north, and my name, Shaneika, it is a very different one. And all my patients always ask, oh, where does that come from? Or I get called Sinead, which is okay too. So whenever my mum was expecting me, my aunt lived in America, and she sent over this baby name book of 2001 names. And I was obviously the firstborn in the house, and it was all a very exciting time. And so they'd looked through the baby name book, and Shaneika was there, and that was it. That was my name. It means belonging to God. So it's very special and very spiritual. And, I did as a child find it very hard growing up because I couldn't get my name on a hairband. And that seemed like the worst thing in the world, that I couldn't get that, or that I couldn't get a door sign. But now I know it's really nice to actually have a different name and to have that conversation and introduction to myself, really. I suppose in terms of why I'm here today, I am a medical physician associate, and I work in Our Lady's Hospital in Navan. So the physician associate role is definitely a new one here for our Irish healthcare system. And really, the pilot program started in 2015. Physician associates as a background have existed in the States from 1960. And that would have been from veterans returning back from the Vietnam War. And they were people who had huge amount of clinical skills, although had not attended traditional medical education. So there was this huge cohort of people who could manage extensive clinical conditions. So the physician associate role was kind of born and was very successful over in the US. So then sort of transfer over to Europe in 2004, the role was adapted in the UK. And then it was further on in 2015, the first kind of physician associates were introduced to Ireland. A programme was set up, and the training then commenced at the Royal College of Surgeons.
Okay, I'm going to stop you there for a second. And you'd have noticed, Shaneika, I put my glasses on. And just to explain to people who are new with this, anytime I do that, that means that I'm doing a double role. So there was something up on the screen there, and I was just checking with Karen and our background team if she could get rid of it. But I don't know if you can see it, but she said it's not visible to anybody else. And I'd be doing that because we're inviting questions from anybody watching this and participating today through the chat box. So if they put in their question, then if you see me when you see me putting my glasses on. So you were here, and I know I was teasing you that you're representing, every young adult on the planet. So obviously you're not. And equally, you're not representing every physician associate either. You're here as yourself. And I know you qualified at a time when COVID-19 was just taking off, and you went straight in to a new job with a new role. Am I right in thinking that you were the first physician associate in the hospital that you're working in?
Yeah, so whenever I started, it was really at that stage where the pandemic had just been declared. We were looking across to Italy and seeing the critical situation that was happening over there. And Ireland really put out their call for medical staff, and they really needed medical staff on the ground as soon as possible. So a lot of programs were actually expedited, and those who were trained medically were really just put on the front line. So my first week in my job, I started in a COVID ward, and it was a COVID ward / ICU. So that was definitely, you were straight into a new job, and quite frightening as well, because you were looking at people who were being diagnosed with COVID who didn't have any pre-existing conditions and were actually ending up quite sick. We didn't really know an awful lot about this virus, so we were continually changing guidelines and getting updates with our PPE. And we also wanted to protect ourselves and our patients. That was really our priority, but also our family members. So hard decisions had to be made to isolate yourself from your social supports because you didn't want to put anyone else at risk. So that was one thing that I found in starting my new job, where usually you would have an awful lot of support and encouragement. That was all kind of done remotely. But I suppose there is a caveat in that why not be put in that position, because you're just fresh from your training. So I think I really remembered that Joan of Arc quote, I am not afraid, I was born to do this, because I always was so passionate about medicine and that I wanted to help people. And so why not at this time when our health system was under immense and enormous pressure? We'll probably never be needed as much as we were at that time. So it really was a privilege to actually be there.
Shaneika, I'm going to come back to that, but just I actually suggested if people have questions that they put them in the chat box. Apologies, I do this every time. If you put them in the questions and answers box instead, please. And we have one question already, so I'll come back to that in a few minutes. I'm just thinking, you've explained the background to physician associate, but I'm just thinking of you finishing college, starting bang in to the COVID ward. So your role, was that confusing for other people? Like, were they thinking you were a nurse or a doctor, or, how did you explain your role to them? And what is the difference between a physician associate and a doctor, or a physician associate and a nurse, or another medical practitioner?
So I was actually very lucky in that where I ended up working, I'd actually done a clinical rotation as a student, and then I'd done an elective as a student. So I had actually been there to introduce the role and really explain what it was that we do. So the physician associate role, we are trained in the medical model. You have to have a background in a life science. So our alumni come from a huge number of backgrounds, and that's biomedical science, paramedics, nursing. There's just this huge variety, and it's brilliant because you pull on everybody's talents then in the training. We start really top to toe. We learn about the body. We learn about the things that can go wrong with the body. It's a very intense program and it goes on for 24 months, but it is a fast-tracked postgraduate master's medical education. And so when we enter, we're expected to really work within a medical team and work underneath the supervision of a consultant, but really at the level of what a junior doctor is expected to do. We're collaborative, we work within the whole multidisciplinary team. And I think that's one of the main differences, I suppose, in a physician associate, is that we don't prescribe medication and that we don't prescribe ionizing radiation. So that's things like an X-ray or a CT, but all other elements of patient care in a hospital can be done by another medical professional. And I think one thing that physician associates can do particularly well is continuity of care for the patient, because often whenever our NCHDs, which is our non-consultant hospital doctors, whenever they are in the hospital, they're often working on training schemes and they rotate every 3 months, whereas the physician associate will stay in the service. So that gives the physician associate an opportunity to actually learn about chronic conditions and to manage a certain cohort of patients who present with chronic conditions. So my scope of practice really is general internal medicine, but I also run respiratory clinics. And it's actually very good in that every time a patient comes to see me for review in clinic, I know the patient, I know when they're well, I know when they're unwell, I know if they come in to us, I can say, oh, we optimized those medications the last time they were in, these are the changes we made, perhaps we can add something else or we can reduce something. And they don't have to explain the whole story again, which I find sometimes patients can find very frustrating. And I understand, because if you're seeing somebody new, they have to find out from the beginning what your symptoms were and how they can help. But in knowing the patient, I find that the patients are very, very welcoming and very grateful that they know me, they know they can contact me whenever they have a flare-up of their symptoms. So from that perspective, it's very patient-centered care.
Shaneika, you've given us a really good outline of your job. And I'm just thinking that you are young, you are a young adult. You went straight from college into probably the busiest job that at the busiest time that anyone could have imagined. And we know, I don't know if it's the same across the world, but certainly in Ireland, my understanding of the medical system is a lot of the hard work gets pushed to the younger people. So you and your peers in the team are probably, yeah, you're nodding, probably doing a lot of work, a lot of hours, a lot of, and this isn't personal knowledge. this is knowing from lots of other people in the situation that it's hard work. Also, you'd have been working with people of all ages. So in the past year and a half, you'd also been working with young people, other young adults, supporting them as patients, or young adults, children of their parents who were sick. So in looking at how your understanding, and I know you're not an expert in the mental health area, but from your own experience in terms of supporting yourself and how your friends are supporting themselves and supporting others, what is it like to be a young adult in 2021, coming hopefully towards the end of COVID, or certainly restrictions being easier?
I think it has been a very difficult time, and it has been a very difficult time for everyone. You know, as a young person, I actually reflected on that I was grateful that I could go out and I could go to my job and I could have that social interaction. And I often thought about, you know, patients or people in the community that were much elderly, and actually they cocooned and they were very afraid of this virus and afraid of catching it and becoming seriously unwell, or in fact actually that it would take their life. For me, in supporting myself, I think it's been very important to kind of have we talk about psychosocial factors, psychological supports and your social supports. So in having healthy coping strategies and in making contact with family, and even though it might not have been in person, in that still we could do it online. And young people, I suppose, are very good at that. You know, we've lots of social media outlets and we can look for those. We know how to Zoom, you know, we've got FaceTime, WhatsApp. So that was one thing. I also found from a clinical perspective, how important it was for reassurance for families whenever patients were in. And you know, this is a very worrying time. People are very vulnerable whenever they're in hospital. And so even just a phone call, just to update someone to say, I was with them this afternoon, they're doing well, and give them a little bit of an update, you know, that really reassured families who couldn't get in to see their loved ones. And I guess just that human aspect really put back in to know that they were being cared for. And I think that bit was really, really important. In other ways of managing, I think lifestyle. So lots of sleep was needed whenever I was working, because I was working long hours. Things like nutrition, physical exercise and activity. You know, we couldn't get out as much into the gym. So, you know, going outside into nature was something I found really useful. And I had to move to an entirely new area. So I actually seen a lot more of that than I would have maybe seen. And I was very grateful for our local landmarks here, that I probably wouldn't have had that historical appreciation for at all. So that's another thing. Personal activities then, I did a lot of self-development work, which I think given the time to step away from everything being so busy, because I think it's so easy to get caught up and be busy in life. So I started to meditate, which I'd never done before. And at the start I found very difficult and thought, oh, I can't do this. I just can't be quiet. But I think even in noticing that you can't be quiet, that also was a bit of mindfulness, I was told. There's brilliant apps. Headspace, I find very good. It's on Netflix. And that's one thing that I would advise young people to have a look at a couple of the episodes, because they're very good. And they gave me a couple of good skills that I could use. Listening to podcasts. I love music, and arts and crafts is one thing that I found I threw myself into.
Okay, and I'm going to come back to the music in particular, because I know you were involved in the Frontline Choir, which was on RT recently. And also I was, thanks to you there, you invited me to the concert in Dublin Castle, which was just one of the highlights from my year. And I think it'll be one of the highlights of my life. It was such a privilege, Shaneika, to be there. But there's two questions that have come in. So I'm going to put one to you and I'm going to take the other one. And again, people who are regulars in this webinar series will know that I just don't ask the questions, that sometimes I butt in, and if I've thoughts and ideas, I'll chip them in, as well as my experience as a clinical psychologist. So the first question here is somebody asking, how do you support a young adult who's experiencing mental health difficulties without intruding on their independence?
I think being there to listen to a young person and, you know, not forcing them to talk. I think sometimes, and I speak on behalf of myself, not every single young person, but I think sometimes, you know, just in knowing someone's there and whenever you're ready to speak to them, I think that's often the best way that we can support them. I suppose there's practical ways as well. You know, if it was somebody that was close to you, you could suggest we could go out for a walk and create more of an open space to have a discussion. But I wouldn't be forcing anyone to sit down and talk and what's wrong and tell me what's wrong. I want to know what's up right now. I would say definitely give some space and show ways that you care about them, and maybe direct them to a couple of supports. And I think in time, if someone acknowledges that they're struggling and that somebody's willing to listen, I think they will respond to that.
I agree. And I'd add in to that as well, that it oftentimes we worry about other people so that we feel better. You know, I sometimes say to parents that they feel happy when their children feel happy. If their children are worried, they feel worried. And it can be really good to give them a little bit of space and to look after our own concerns. And just to flag that there is an aware group, an aware service that is free of charge on for relatives and friends to help them understand what's going on in terms of depression, anxiety. And the feedback we've got on those programs, Shaneika, have been really, really, really helpful. So, so thank you for that. So the other question I'll take, and equally if you want to chip in, somebody saying that they have Asperger's and extremely horrible childhood, asking how they can manage their depressive symptoms and their anger issues, low self-esteem in a more positive way, instead of being aggressive and controlling their eating or some aspects of their life to be in control because everything is out of control. I think that's a great question for me to realize that the person who's written it has quite a lot of insight and understanding of what's going on. And for people who aren't familiar with Asperger's as a term, it's sometimes seen as in the milder end of the autistic spectrum. And for people who have Asperger's, the world can seem a bit confusing, I think, because there can be a tendency for maybe them not to get humor or to maybe find social situations a little bit awkward. And definitely childhood can be very, very difficult. I think it can be challenging for any of us. So the question how to manage that, I think the awareness of having it is really key. And then getting support, asking for support, getting support, taking support. So that could be as a first step, going to your GP and talking to him or her about it. And then again, looking at the aware services, but equally going to someone who has a particular interest and experience in Asperger's and working with people on the autistic spectrum. And the person who always comes to mind for me is Dr. Rita Honan and her associates. Rita is massive expert. I'm trying to think of the best word to describe her. Real expert in, and her website is Honan and Associates, I think, Honan. So that would be for people to learn more about it. And for me, again, reading that question, Shaneika, I'd be interested to see what you think. But the sense of anger towards itself about I'm not doing enough. I'm being too aggressive. I'm not controlling my eating. There's a harshness that any of us can have, which does not help in terms of our mental health. So kindness, self-compassion, understanding, realizing that life can be very, very, very tricky, very complicated. And there's a lot going on for all of us. So the kinder we can be to ourselves, the better. So what would you think? Is there anything that you'd disagree with what I've said, or is there anything else you'd like to add?
No, I definitely agree with what you've said. And I think sometimes, yeah, it's all about being compassionate and kind to ourselves, and being gentle and trying to be less critical of what we're not doing. I think even sometimes small steps are still steps. And so if we're taking, if we only achieve one thing that we want on our to-do list that day, that's still a step forward. So I wouldn't be so hard in the things that you can't do, but try to look at least one small thing that went well today. In particular, I've been doing gratitude journaling throughout COVID and all of the things that I'm grateful for. And I think that's allowed me to foster a much more compassionate attitude towards how I'm doing and how I can move forward.
Thank you for that. And I'm really struck by, there could be people watching this, young adults watching this, who are saying, oh, it's all right for her. You know, she's professional, she's got a really good job, she's, she looks beautiful, she's successful in whatever way. And you'd say, no, 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 no. So that's fine. I'm not going to debate that one with you. But there definitely will be people who are thinking, I'm not good enough. Now, they might look like you, they might have the same career as you, they might be as successful in quotes, but they're thinking, I'm not good enough. And there can be a sense of a harshness towards ourselves, as we mentioned a few moments ago, but also a sense to put ourselves down And my experience of working with young adults is that they can be really good at that. They can compare themselves unfavorably to everybody else. And people saying, you know, but you're great, you're really good, you're confident, you're this, you're kind. They will look at know what they consider themselves not being good at, and they'll blame themselves. And that doesn't help in terms of mental health, you know, with physical health. If we eat loads and loads and loads and loads and loads of Mars bars, you know, 20 Mars bars every day, we're not going to feel good, or any other type of sugar, not to be down in the Mars bars industry. So there's a way that we can mind that, can really acknowledge what we're thinking, look at how we're feeling, and really focus on what we're doing, the helpful actions. And there are two more questions that have just come in. One is, how do I overcome an anxious attack and anxiety contemplation? And does the flooding technique work? I'm happy to take that because it's a technical question, but if you'd like to talk to first, Shaneika, that's fine too, or pass it back to me, whichever.
I'll pass it back to you, but then I'll speak afterwards.
Okay, perfect. So I think, again, awareness, I really like CBT, cognitive behavioral therapy, as an approach. It's very simple and it can be very, very powerful. So understanding that if we're experiencing anxiety, then we're going to feel anxious, our heart rate's going to race, sick feeling in our tummy, and really understanding that that is our body's response to danger or what we think is danger. And it can be really uncomfortable, it can be very frightening, it can be very scary. And a lot of us, to feel better, can tend to avoid whatever the thing is, and then we feel better immediately. But then actually this links with the next question, which is, I'm anxious wherever I go. I haven't been in school since the start of the year because I'm so anxious. Any advice? So that fits with that question too, because we can avoid. But then it backfires, because the more we avoid, the harder it is to get back there. So flooding, does that work? So flooding means going straight in, taking a deep breath, going straight in. In my experience, yes, it can, if the person knows what to expect. So lots of times people really want, when they're experiencing anxiety, to feel better. So they do things to feel better. So facing whatever it is that's making you feel anxious is actually going to make you feel worse initially. But once we know that, then things can begin to improve. So for instance, as you know, Shaneika, the treatment for cancer is one of the treatments, chemotherapy. It doesn't make people feel good, but we know that. So people who are going through chemo, they know their hair is going to fall out possibly. They know they're going to have a sick feeling in their tummy. So they're not beating themselves up because of that. They've been prepared. So somebody who is, in my language, taking their power back from anxiety, facing whatever it is, knowing that initially that's going to create more adrenaline, make them feel worse, can be of help. But if they're facing whatever it is and they're blaming themselves because they're feeling however they're feeling, then that can backfire. So in my training as a clinical psychologist, I was encouraged to work with people that face a little bit, whatever you're anxious about, then the next thing a little bit harder, and then the next thing, and then the next thing. And sometimes that works really well. And sometimes it backfires because people can minimize what they've just done and then really focus on what they think they won't be able to do. So sometimes facing the hardest thing, or a very, very hard thing, can work effectively if they've got support to do it. So that's my if. So what would you think, Shaneika?
I suppose I would just say, for me, I find when I'm particularly overwhelmed, breathing is really important. From a kind of a less technical point of view, remembering to breathe. And I think, whenever we do become anxious, we become more tense, and all of that cortisol's running around our body. If we step back and we think about the thing that we are worried about, and just actually taking a couple of seconds, it doesn't even have to be minutes, it doesn't have to be an hour, it's a couple of seconds. There are a few really good breathing techniques that I have come across, and that I actually sometimes have to personally use in my work whenever we face difficult situations. One is using the hands. So if you trace up, so you'll breathe in, breathe out, breathe in, breathe out, and just trace that. And sometimes that can just relax the body, and you can think a little bit more clearly. There are other ones. There are box technique breathing, if people want to look that up. And then there is another one where you look at the five senses. So you'll think about five things that you can touch, and you name them in your head, and then four things I can see, three things I can hear, two things I can taste, and you work it down. And I think once you've initially taken that step back, you can think a little bit more clearly, and sometimes that just gets over the initial anxiousness. And sometimes, you can have very physical sensations. If you're feeling sick, nauseous, you're shaking. So sometimes that can help.
Okay, thank you. That makes a lot of sense. I love the hands. That's a new one for me. So thank you very much. I'll absolutely be sharing that. The school, the advice about the specific question about school, I would be encouraging that person to take a deep breath and go back in, to really do the breathing exercises to get support, but to realize this is hard and still do it. The longer the person stays away from school, the harder it's going to be. And another person is saying, that whether CBT is good for autism, recently diagnosed an adult who's transgender, CBT tried but failed quickly. That's an interesting question, because sometimes people, when I'm working with them and I ask, what would you like to get from working with me, and how would you know if it's helpful? A lot of times, myself included, we want to feel better. And with anything, if with anxiety, to take our power back, we might feel worse. If we've a tendency towards depression, and that can be anger turned inwards, if we're looking at what's underlying that, we might feel really, really angry. So there can be a tendency to give up on whatever it is, whether it's cognitive behavioral therapy or interpersonal therapy or family therapy or whatever it is, very, very, very quickly. So there is a match. So I'd encourage that person to maybe explore it a little bit more, but also to check with Rita, Dr. Rita Honan. I put any questions for anybody with autism over her way. I think she really is the expert in it, and her team. Shaneika, I'm thinking, there's another question here, but I'm thinking a lot of the young adults I've worked with and I've met socially, friends, family, we've gained a lot during COVID. We've realized how resilient we are. We've realized that we can survive without massive social contact and all of that. But I think now we're becoming aware of what we've actually lost. So young people have lost maybe on graduations, or they've lost on Deb dances, or different things. And some of them put on a front, so they're not going to let anyone else see how they are. The makeup is perfect. Everybody thinks they're great. But there can be a sort of a resentment creeping in, or an anger creeping in, which I think is great, so long as we acknowledge and we do something about it. Is that just me, or have you noticed that?
I think, in general, I think that young people have been quite resilient and adaptive to the changes. In many cases, we haven't really had a choice, because there have been government restrictions, and that has just been the way that the levels were, and we just had to accept it. But I do think, as a young person, there are certain events in your life that are milestones, and that you do think would have been a lot different. And my own graduation included, like, we were the first cohort to graduate virtually. And to be honest, my virtual graduation was actually a pleasure, because I got to spend it with my family. There were certain elements of it that made it even more special. I got to see the people that I wanted to see on my graduation day, and I got to share it with them. Whereas if it had have been in a real ceremony, I maybe would have been allowed one or two people, and that would have been it. I also found that my family made it even more special, to almost kind of make up for missing it. And my dad had actually went to B&Q, and he'd bought a little bit of plastic pipe to make for a scroll. And for me, I just found that meant so much. And it was a piece of plastic plumbing pipe. And I think certain things we've done very creatively to make up for things that we've lost. In terms of what I'm seeing clinically, yeah, I guess sometimes in mental health presentations, yes, you can see that increased loneliness and isolation has really impacted some young people. And, you know, in terms of school disruption and not being able to see their friends, they have found that very challenging and very difficult.
Yeah, I'd like to use the opportunity to say something that anyone who knows me and knows my work well would know. Oh, I know what Claire's going to say next. And it's something that when I'm working with people of any age, they can be very frightened by particular thoughts they might have, that they've had enough or life isn't just working out the way that they thought it would. And then there can be thoughts around that they're better off dead. And those thoughts, I think, particularly for young people, but maybe any age, can be really, really frightening and shocking. And I think there can be a tendency to jump very quickly to label those thoughts as suicidal thoughts and to label the person as suicidal. And I always make a distinction because they're thoughts. And some people can have those thoughts and they can feel worried, upset, shocked, frightened. And some people indeed have those thoughts and they feel relieved because they see taking their own life as an option. And as a release. But the key thing is, just because people have those thoughts does not mean they're suicidal. And just because they think they are does not mean they have to do it. There are always options. We know, and we haven't talked about alcohol, Shaneika, but we know that there's a problem in Ireland with the drinking culture. And I think that is going to emerge over time. And when I'm working with young adults and I ask them about alcohol, they'll say, oh, I just drink normally. And I've learned, to explore that question a little bit. And certainly normal might not be seen as okay, as appropriate. And alcohol can take the brakes off. So people can harm themselves under the influence of alcohol in whatever way that is, in a way that they would not do if they were sober. So in terms of the alcohol, and I'm just talking in a general way, but is it, I'm a lot older than you, obviously. So is it something that is a problem for young people, that the binge drinking and the culture and the impact on their well-being, mental health, physical health, and all of that? Or is it that older people just don't have a sense of what it's about?
Oh, so I do think, whenever you are much younger, now I'm talking like late teens, there can be that pressure to drink to be cool, and to drink to go out and think that you need to have alcohol on board to have fun. Often our first kind of couple of years at university, I think, is all about experience and that, and experiencing this kind of rite of passage almost, that you don't really have to be that responsible. You just have to show up to your classes, and as long as you can, then there is a culture of binge drinking. As I've come out of uni now and I'm the other side, and obviously my last degree, it was much different because it was postgraduate. So I found that beyond that age group, that there was significantly less of that. But it can impact people negatively, for sure. And I do agree with you in that sometimes it can take the brakes off, and that irrational decisions are made on the basis of alcohol.
So I think that's a discussion that, when we're planning webinars for next year, I think we could have one focus specifically on this topic because it's huge. We've got a question here from a lady and saying, what about if a young person isn't able to verbalize what they're anxious about? And indeed, that can apply to people of any age. or if they're anxious about everything in general. Again, I'm happy to take that, Shaneika, but do you want to say something to that?
I guess I would look at if this young person isn't able to verbalize, and not everybody is, you could look at things that they like. You could look at art. I think art therapy is one thing that is very useful actually in mental health. Crafts. If they're into sport, perhaps maybe they might find an outlet in sport. And then if perhaps music is something that they find that they relate to, that they could look at that avenue. I know what music for me is just so special, and can be so emotional as well. And you don't have to do any talking to express yourself in music or any kind of art, really. So that is one thing that I'd advise in kind of looking at those things to see if there's any other way that you can get them to express without actually having to say words.
I'm going to expand on that as well, and thank you for that. And then I'm going to come back to ask you about the frontline choir. And see the smile? I just knew straight away. You think, oh, thank goodness, I'm off the hook. But the way I've answered that question as well is, to me, it's a reflection of an older person concerned about a young person and thinking if they would talk, then they would feel better. And the pressure is often on talk about it, talk about it, talk about it. I always put a question mark on that though, because if the conversation is about how difficult things are, how terrible things are, the mistakes we've made, how stupid we are, why are we feeling anxious, that talking about it, verbalizing, isn't as helpful as talking about it in a different way. So a sentence I've developed that really captures the key elements of cognitive behavioral therapy is what I've called the ABC coping sentence. And again, people probably heard me say this before, but A is acknowledge. So I feel anxious. B, because I think I'm just not going to be able for it, or because I think school is too hard, or because I think I'm just not good enough, whatever it is. And then C is choose. What are we going to choose to do? And I choose to breathe slowly is a very powerful one. With anxiety, I choose to take my power back. I choose to face it anyway. I choose to be kind to myself. And then we can use the ABC coping sentence in reverse. So somebody who's struggling to verbalize something, we can say, I think you're feeling a little bit anxious because I think maybe there's so much going on for you right now. But what can I do to help you do something helpful for you? And that's exactly what you were saying, Shaneika, in terms of the arts and crafts or the music or the things that give us pleasure. And we know in helping people prevent depression, it's so important to do one thing every day that gives us pleasure, not alcohol related, obviously, and it doesn't have to cost money. So that's a great introduction to the frontline choir. And what has your experience been as a member of the choir right from the beginning?
So the Frontline Choir has been running an RTE, and it has been under the instruction really of David Brophy. And initially, whenever I got the email to say that I'd been nominated, I was just absolutely over the moon. I've been in choirs my whole life. I love to sing. So for me, music has always been a medicine. And whilst I was having really hard days at the start of COVID and I was working on the COVID ward, I kept saying, whenever everything is normal, I'm going to join a choir. And we kept pushing back. Every 6 weeks, I think we'd look and things still weren't opening up. And I had to actually stay somewhere self-contained and couldn't go home. So I couldn't play piano. So music was this huge part of my life that I was missing. So whenever I got this nomination, I got asked a few questions and I sent them off, and then I got a phone call. We eventually then all met up on Zoom, and it was just such a privilege because everybody really was represented. And that is one thing that I really loved about it, because our Irish healthcare system is made up of so many people. There are so many professions that I don't think were truly recognized whenever we were talking about our frontline workers, because the hospital runs with everybody. And I suppose a bit like a choir doesn't function without everyone. It isn't as rich, it isn't as efficient. We need everyone there. We need our cleaners, we need our cooks, we need our admin staff, we need our nurses, we need our doctors and our carers, we need our porters, we need everybody. And so I really felt the frontline choir was fully representative of that. And as a physician associate, and there are only around 50 of us in the country, was just enormously privileged to have been even included in part of that. I find music is really one of life's most important survival tools. It nourishes you, it gives you hope, it heals you, it gives you strength just to get through the hardest times. And that's what I have found it has done for me.
The songs that you chose were so inspiring. I was at that concert with tears literally rolling down my cheeks. And Shaneika, I'm listening to, and again, I'm really struck by that people might get the wrong idea. And this is because I do know you personally, that, oh, well, things work out well for her. I know how hard you work. Actually, I don't. I know a tiny piece of how hard you work. And the resilience you have built up over the last year and a half, I know will stand to you for the rest of your life, in terms of turning up as part of a team. Your team changes on a regular basis, meeting new people. So there are lots of young people who might see themselves in quotes as failures, that they haven't been able to achieve whatever they want to achieve. And not everybody goes to college, and not everybody needs to go to college, but whatever their dream is, and they might be feeling stuck right now, and they might be saying, well, I'm not able to do that. And I just like to give a very quick overview, and I might expand on it maybe in another webinar, of something I came across years ago doing research that I found very helpful, the coping resources inventory. And it's a way of looking at how do we cope with stress and challenges. So yes, we can have coping strategies. We take a deep breath, we count to 10, we distract. But the coping resources, and it's an idea of two men, Hammer and Martin, there are 5 of them. So there's the cognitive, there's what are we thinking? So are our thoughts helpful? Are they unhelpful? There's emotional. Are we able to express emotions to ourselves and anybody else? Do we bottle up things? Do we pretend everything is great, but actually receiving with anger or upset or loneliness? So an ability to express emotions. Social, an ability to ask for, get, and take social support, being able to be honest with people. This is what's going on for me. And obviously we each choose the person and the people that we trust to be vulnerable with. And then physical, you've mentioned that, Shaneika, the diet, eating nourishing food on a regular basis, exercise, doing things that we really enjoy. And then there's a 5th one that the research would say is actually the most important one in terms of helping us develop resilience and cope with stress. And you've referred to this too with your gratitude journal. It's called a spiritual stroke philosophical approach to life. So we found that people who've experienced real difficulties, Nelson Mandela, Viktor Frankl, Brian Keenan, people who've been abducted, put through horror, and also people in the front line during COVID in whatever way that capacity is, and that includes bus drivers or anybody who's been out there working. There've been an opportunity to look at a bigger picture and say somehow there's a purpose to this. And I found, in terms of helping young adults to deal with the frustration, resentment, or anger, or whatever, to come back to, I feel upset because I think whatever, but I choose to make my life count, or I choose to build on it, or I choose to recognize and appreciate what I do well. So that's me coming towards an end, but you're our guest speaker, and I'd love you to give us what you'd like as a takeaway, Shaneika, 1 or 2 or 3 points, whatever you'd like, representing yourself as a young adult working in extremely challenging times over the last year and a half.
So I think just taking away really about what you said about the resilience bit, I think we're very well versed in going to the gym, and that makes us stronger if we want to build muscle, and the things that we potentially maybe need to do that. We need to eat well, we need to sleep well, we need to be committed and to that routine. I think resilience is very much like that also. You know, it is a muscle that we can build, and by using those coping strategies, we can get better at it. We can be stronger. And in doing so, you know, just like muscle building, we improve our performance, we improve our endurance, and that we can cope. And we are stronger than we think we are, despite really difficult situations that we may face. I think in saying all of that, my take home would be that everyone is kind and compassionate to themselves, to the others around them, and to really pull on those meaningful connections that they have in their lives. So many more people care about you than you actually think do. It's not just family, it's not just friends, it's colleagues, it's strangers. And you know, that's one thing I would just really, really say.
I echo that. And I'm just thinking, when you're saying so many people care, the little girl Cleo, who was rescued in Australia last week after being abducted for 18 days, we saw the kindness of the police officers. Nobody shouted at her for being so stupid as to be kidnapped. And, you know, nobody will. How on earth could they? But as adults, I think we can treat ourselves really harshly. So really treating ourselves with the kindness. Shaneika, it's been an absolute pleasure and a privilege. And I really appreciate you doing this, because it's not easy to put yourself forward representing yourself and physician associates, but also, you know, some of the questions I've asked you about the young adults. And I know this has been of benefit. Is there anything else you'd like to say before we finish?
I just like to say, you know, it has been such a privilege to be here today. So thank you very much. And I know if anyone's watching and they're thinking, oh, but she's been to college and she's in a job, you know, we all have challenges, and I do believe that we have the inner strength to get through them. So whatever it is you're facing, you do have that strength to get through it.
Yeah, absolutely. So thank you very much. And I'd encourage anyone who wants to follow up on any of this to have a look at the Aware website. And if you have any concerns, if you're left with anything, your GP, it's really, really important to talk to your GP. And this brings us, and Karen is spot on in terms of putting up the next slide. So thank you. So our next webinar, the December one, is the second Wednesday, so the 8th of December, and the traditional shopping day in Dublin years ago at 12 noon. And we're looking at lessons learned and looking back and looking forward. So I'm delighted. I'd be looking forward to that. But Shaneika, I'm just so delighted to have had this conversation with you. Thank you very, very much. Garmila Mahagat.
Million Claire.